Minister of Health and Wellness, Dr. Christopher Tufton, says he has received reports of fake vaccination cards being sold. We hear more from Simone Absalom-Gayle.
Health and Wellness Minister Dr. Christopher Tufton says the issue of fake vaccination cards is being investigated by the authorities. He says faking vaccination cards or selling them is a criminal act.
We do have the database of all persons who have been vaccinated legitimately, and as a consequence can validate or verify or cross-check to see if someone with a card is in fact vaccinated. However, I think the injury here that we're trying to address is the extent to which the cards can be manipulated. And we are looking at how we can move from a paper-based signature and stamped card, which clearly has greater risks in terms of manipulation, despite the fact that it can be validated through the database cross-checking, to a more digitized approach.
Dr. Tufton says his ministry is in possession of a software that can be retrofitted to track vaccinated persons and their cards.
We had announced and unveiled it some months ago. This is a UNICEF facility that we had adopted and tailored it to what we have in-house in the ministry. So it really would be to add another leg to that, which is how we digitize on a card for persons. I think that process has to take place, and we need to move speedily towards it for more than one reason, not just for the one you raise, but also for the fact that our capacity as a country to interact with other countries for trade or otherwise, like the US, is going to be impacted if we do not conform to those standards that require validation of vaccination.
He also alluded to a recent U.S. announcement that starting November, only visitors who are vaccinated will be allowed in that country.
It then raises now the issue of how do you prove that you are.
Jamaica's Chief Medical Officer, Mrs. Jacqueline Bessessa McKenzie, speaking at a high-level Pan-American Health Organization meeting recently, asked that the World Health Organization and PAHO intervene to ensure that essential medicines and health technologies that have gone through the rigors of approval are recognized and accepted globally. For the news on PBCJ, I'm Simone Absalom-Gayle.